Lost sense of smell may be peculiar clue to coronavirus infection. Doctor groups are recommending testing and isolation for people who lose their ability to smell and taste, even if they have no other symptoms. A mother who was infected with the coronavirus couldn't smell her baby's full diaper. Cooks who can usually name every spice in a restaurant dish can't smell curry or garlic, and food tastes bland. Others say they can't pick up the sweet scent of shampoo or the foul odor of kitty litter. Anosmia, the loss of sense of smell, and ageusia, an accompanying diminished sense of taste, have emerged as peculiar telltale signs of COVID-19, the disease caused by the coronavirus, and possible markers of infection. On Friday, British ear, nose and throat doctors, citing reports from colleagues around the world, called on adults who lose their senses of smell to isolate themselves for 7 days, even if they have no other symptoms, to slow the disease's spread. The published data is limited, but doctors are concerned enough to raise warnings. We really want to raise awareness that this is a sign of infection and that anyone who develops loss of sense of smell should self-isolate. It could contribute to slowing transmission and save lives. British Rhinological Society. 2 ear, nose and throat specialists in Britain who have been infected with the coronavirus are in critical condition. Earlier reports from Wuhan, China, where the coronavirus first emerged, had warned that ear, nose and throat specialists as well as eye doctors were infected and dying in large numbers. The American Academy of Otolaryngology posted that mounting anecdotal evidence indicates that lost or reduced sense of smell and loss of taste are significant symptoms associated with COVID-19, and that they have been seen in patients who ultimately tested positive with no other symptoms. The symptoms, in the absence of allergies or sinusitis, should alert doctors to screen patients for the virus and warrant serious consideration for self-isolation and testing of these individuals, the Academy said. The organization has reminded its members that the Centers for Disease Control and Prevention has urged all clinicians to prioritize urgent and emergency visits for the next several weeks and to reschedule elective and routine procedures. There is evolving evidence that otolaryngologists are among the highest risk group when performing upper airway surgeries and examinations. A high rate of transmission of COVID-19 to otolaryngologists has been reported from China, Italy and Iran, many resulting in death. In the areas of Italy most heavily affected by the virus, doctors say they have concluded that loss of taste and smell is an indication that a person who otherwise seems healthy is in fact carrying the virus and may be spreading it to others. A study from South Korea, where widespread testing has been done, found that 30% of some 2,000 patients who tested positive for the coronavirus reported experiencing anosmia. Patients in Germany, roughly half of the patients had experienced a smell or taste disorder, and that the sensory loss usually presented after the first symptoms of respiratory illness, but could be used to distinguish people who should be tested. Several American patients who have had symptoms consistent with the coronavirus, but who have not been tested or are still awaiting test results, described losing their senses of smell and taste, even though their noses were clear and they were not congested.